Hello, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today, we're interviewing Alexis Sams again for the second time.
Yes.
So welcome back, Alexis.
Thanks. I'm glad to be back.
For those of you who don't remember, Dr. Sams received her doctorate in physical therapy from Long Island University in 2008. With her degree, she has focused her efforts on providing physical therapy services to athletes and performing artists across the country, including dancers, cheerleaders, musicians, marathon runners, and CrossFit athletes. In 2014, she founded ANS Fitness and Physical Therapy in Arizona, which provides dancers with performance evaluations, fitness and conditioning classes, physical therapy, education and screenings, and technical programs.
Alexis is here today to discuss causes of pain in dancers. Let's do this.
Okay. All right. First question, Alexis. Is pain commonplace in a dancer's career?
Oh, yes. And I'm sure everybody knows that.
Mm-hmm.
Yes, pain is definitely commonplace. Not so much traumatic type pain. Actual traumatic injuries that result in pain are very few. So those single episodes or accidents of I ran into something or I fell or I got dropped, those are pretty rare. It's usually the overuse type of an injury, movements or episodes that happen over and over and over that create little tiny bouts of pain, but those little tiny bouts of pain get more and more and more and more, and then it kind of ends up being kind of that straw that broke the camel's back that turns into a significant pain issue, and that's usually the type of pain that dancers tend to experience, or at least the ones that I end up working with.
Mm-hmm. If a dancer feels pain, say, in the foot, does that mean that the dancer's foot is injured, or could it be something from someplace else?
Yes and yes. Simply, to answer the question simply, actually, this relates to a blog that I just wrote about pain not being the problem. Pain, when I explain it to my clients, is a signal. It is the body's way of telling you that something is not quite right. Does that mean that something is detrimentally wrong and you're never going to dance again and we have to amputate? No. More often, it doesn't mean that extreme. But it is a little signal to say, hey, something's not working quite right. Let's just try to figure it out so that we can go back to working normally. The body's normal way of working should be without pain. So your example of pain in the foot, does that mean it's actually injured? It might not if it's caught early and you do something about it early. It might just be the body's way of saying, hey, something's not sitting quite right. I'm getting a weird pull or a yank. Can we just fix this? Can it be a sign that there's something going on somewhere else? Yes, a lot of times pain in one area does not mean that that's where the problem is. So sometimes it's easy for me to figure out where the pain is coming from or the cause of what's happening with the pain, or sometimes it takes me a little bit longer to figure out. But it is possible that a pain symptom in one area can link to problems in another area. I can give one quick example. Yeah. A lot of knee pain in dancers, a lot of time is coming from issues in the hip and or the low back.
Yeah.
So,
yeah.
Just to give a very clear, concise example.
Yes. Is there such thing as good pain?
I think we're very used to hearing the term good pain.
Yeah.
What I tell my clients or their parents or dance instructors is that what I like to say is that there's pain that we expect in a given condition with a given activity. So there's expected pain or there's anticipated pain or discomfort. Then there's pain that we don't anticipate or pain that we don't expect to happen. And those are the types that we want to make sure that we get checked out. For example, with flexibility, with stretching, as we call it, the tension that's felt when we're near the end range that our bodies can handle at that time, some people interpret that as pain. But that's what we expect. When you're at the end range and you're trying to achieve a little bit more, you're going to feel that tension. So we expect that. Some people refer to that as the good pain. I call it's an expected discomfort or it's an expected symptom. The low back pain or the occasional foot or joint pain from other causes, or you're not quite sure where it's coming from, that's usually going under the category of unexpected or unanticipated pain. And those are the types that you want to get checked out.
So, okay, so let's redefine. So instead of good pain, we're going to talk about it as expected pain. Is it safe for a dancer to dance through the expected pain? So like for example, the discomfort you feel at the end of a hamstring stretch, or let's say you had a dance heavy day and your quads hurt. Is that okay?
I would say for the most part, we could consider that okay. In a single situation, we know why it's happening. Like you said, we had a heavy dance day, we worked on some new choreography, and my quads are sore. And I get up the next morning and my quads are really sore, and we can call that, or you choose to call that, pain. But we know why it's happening. It was in hindsight, you can define it as anticipated, and it kind of dies back down. It fades itself out over the next couple of days. Not necessarily cause for alarm. But again, there are other cases where pain is not going away. You can't quite figure out why you're having it. It's sticking around. It may be fluctuating in intensity. It's getting worse. It's getting better. It's getting worse again. Those are the things that you kind of want to get checked out. Does that answer your question?
Absolutely. Yeah, I think that makes good sense.
Let's move on to medication. So medications such as ibuprofen, is that the best way to treat pain? Also, what about RICE? Rest, ice, compression, elevation.
Yes. I'm a big fan of RICE early on in what we call an acute stage. So I'm dancing, I'm running, I'm walking to my next class, and I twist my ankle. I'm a big fan of RICE right there. So a little bit of rest. I'm not necessarily advocating like the laid up for 2 weeks, but maybe take a chill for that evening, your ice, your compression, and your elevation. Now, ibuprofen, I sometimes making sure that it's appropriate, because, I'm not really licensed, or it's out of my scope of practice to talk about specific medication, prescriptions and dosages. So I usually, tell my clients, if they're used to taking ibuprofen to reduce swelling, I let them know that that's the number one reason why most people take it. It's more for reduction of swelling versus actual reduction of pain. You might get reduction of pain because the swelling is reduced, but usually the mechanism of ibuprofen is to reduce swelling. If they're used to doing that, if they not had any big reactions, if they want to double check and speak with their doctor about it because it's a medication, they can do that. I always tell them if they choose to do that and it's over the counter, at least make sure they're following the directions on the bottle. But circling back to answer your question, those are all things that I use or that I'm okay with in an early on acute state when somebody first identifies that they're having a pain issue. If it's lagging on, usually that's, again, the body's way of saying something's wrong. It needs to be checked out. More often than not, I'm not recommending those things for my clients if they're coming in saying that they've been having the pain for a long time. Usually I'm getting my hands in there, or I'm working with educating them to restore any pelvic asymmetries, any muscle imbalances, making sure that they're exercising appropriately, and that more or less fixes the problem when it's outside of that acute state. Anywhere between, I'd say, 24 and 72 hours after they first notice pain. So usually anything after that, RICE might not be the most appropriate, or ibuprofen might not be the most appropriate. Sometimes it is, but I definitely stick to the early stages of using those types of things, or those types of methods.
Yeah, that makes sense. Okay, so I know it depends is always the answer, but if you go to a doctor and the doctor says that you should rest and take time off of dance, we should do it as he or she says, right?
It depends.
It depends. I called it.
One thing I'll say is I've never advised a dancer or parent to blatantly just go against doctor's orders. So I wouldn't advocate, saying, no, the doctor's wrong, I'm going to go right back to dance. A lot of times doctors, And doctors are great. I have a lot of friends who are orthopedic surgeons or osteopaths, so I'm not definitely saying that doctors are not valuable medical professionals. Obviously, they are. Mm-hmm. However, specifically with the dance community, we still run into two issues with medical doctors. One, they might not always have the biggest appreciation for what dancers do to the degree that they do them. Mm-hmm. They might not know that you're dancing 5 or 6 hours a day for anywhere between 5 to 7 days a week. They don't know the degree of flexibility that you have or you're trying to achieve. They don't know the rigors or the challenges of your choreography. So they don't always have a big perspective for what dancers have to be able to do. Mm-hmm. And that being said, they go with the safest route. So that's just do nothing, just rest.
Right.
It's fine.
Right.
So they might honestly be acting in your best interest based on what they know about what you do, mm-hmm. but that might not be the most appropriate or the most effective way for working with dancers in the dance community. I can say most clients end up coming to me because they know that's one of the number one things that I don't end up saying. It's rarely the first thing that comes out of my mouth. It is very rare that I tell a dancer to stop dancing. A lot of times we have to have a conversation about what they can and can't do. Mm-hmm. But the conversation ends up being worth it because it allows them to continue to participate in their activity. And we have that conversation frequently so that we know, so that we can gradually grow their participation so that they can get back to dance at 100% as quickly as possible.
If there's a dancer listening into this podcast and is experiencing pain, what would you suggest he or she do?
I would say work or try to find a physical therapist to at least get a consultation from. The PT profession is a profession of movement specialists. So we deal with movement and dysfunction, what happens when movement goes wrong. We also can be the experts of musculoskeletal problems. Those are our two focuses. If you're lucky enough to have somebody or have a physical therapist in your area that has a dance or a sports related background, seek them out. I'm always available virtually, at least for consultations, across the country. So anybody can shoot me a note or shoot me a message if they have any questions. I also work with a network of dance medicine specialists, physical therapists across the country that I can hook you up with, see who you're closest to. But I would definitely try to identify and work with a physical therapist first. And if you can find somebody who understands the demands of dance, that is great. If you don't know them, call me.
Excellent. So look in our description below because there will be a link to Alexis's website. Mm-hmm. So Alexis, I know you wrote a blog post about pain is not the answer, which is what inspired this topic. Is there a particular story that inspired you to want to speak about this?
I don't know if there's a specific story, mm-hmm. but I think just seeing so many dancers just trying to... The first thing that came to mind is self-medicate, but that might not be the best word. Mm-hmm. But, you know, taking ibuprofen or taking Tylenol before you even step in class because you know that this class brings on pain. Mm-hmm. Bathing yourself in Tiger Balm to help reduce symptoms mm-hmm. or help reduce pain and get you through a class. Just things like that, just seeing so many dancers with ankle braces or knee braces or kinesio tape, mm-hmm. Time after time after time for weeks and weeks and weeks on end. That's not necessarily something that's completely normal, even for dancers, even for high performance athletes. And they're doing it because I think they're stuck in this stage that when I do those things, my pain is less,
right?
Which is true. But going back, pain is the body's way of telling you that something's not quite right. Mm-hmm. So I feel like they're stopping there at addressing the pain instead of taking another step and trying to figure out what the problem is that's causing the pain, right. And trying to identify somebody to help them. So that's kind of what inspired me to write my latest blog about how pain is not the problem. It's a signal, and it's a signal to talk to somebody and to try to get something done so that you don't have the pain.
Right. Yeah. And maybe you can dance longer.
Exactly.
Thank you again, Alexis, for sharing more of your knowledge with us. And again, thank you to our listeners for joining for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com. Thank you again, Alexis. We appreciate this so much.
Oh, no, thank you.
Of course. And also, if you want more information, I know we said it before, but check in our description below for a link to Alexis's website as well.
Yes.
All right. Bye.
Bye. Thank you.